The Armor tool really was born from the need of polypharmacy and redundant treatment in elderly. And as you know that 35% of hospitalization are due to medications in elderly, and caring for elderly for a long time, we come up with a clinical, I would say, set of rules that would more tie into their biological and psychological need. So that way we could eliminate unnecessary medication burden, optimize the treatment, and yet not overdose people or underdose people.
We've always been concerned in this industry about 9 or plus meds, and without really any more definition than just we need to reduce medications. And through this process, especially with nursing, we've been able to look more at, what are the medications for? What are the goals of the medications? What should we be looking for?
What we really do with Armor tool is we methodically go, look at each step and find out what therapeutic interventions are appropriate, match those against the correct diagnosis, and approach in a team setting to achieve the goal.
The goal isn't just to get the resident well or just to be pain-free, it's to be able to meet all of the residents' goals. And some of those are certainly as important as whether or not they go home.
The team, essentially there's a core team, which means you have a director of nursing, clinical manager, social worker. And the peripheral members of the team include recreational therapists, activities director, whoever has a patient interaction and a view either about the biology of the patient, psychology, or sociology of the patient. So like a biopsychosocial model. Right. And then those members can exchange information which could help shape up the care plan for the patient. Patient-centered goal. Is he seeing the same goal as you guys are seeing? Your goals are matching with his goals?
He was really happy about losing weight and being able to get up and wanting to go home.
I think with the tool, instead of all just focusing on our areas of expertise, because of the tool, it's allowed us to now kind of step outside our box and look at other issues as well.
Everyone now has a voice. Every department has a voice where it's concerning the resident care, the care guides, the care plans, how we approach each resident.
Our nursing staff are more confident because they understand and are able to articulate to the physicians, and it makes the physicians more confident in what we're doing and, understands, and so it's improved everything.
It's decreased in falls, we have a decrease in cost, the increase in interaction with the whole team and that patient. And it's better communication with our team because of using the Armor tool.
And there is a clear reduction in cost of care and increased functional activity. And more important is less behavior than psychotropic. We absolutely focus on the psychotropic for unmet need of the patient and try to do is take away the redundant psychoactive meds.
It's allowed us to kind of find the root of the problem instead of just thinking that every behavior might need a medication.
All around it was, kind of a win for every, aspect of, resident and staff and families too. Families always are concerned about the number of medications. And then when we're able to explain, intelligently about what we're looking for, they're more confident.
In a way, the tool, if it is approached in an interdisciplinary setting, which is a missing piece in elder care, particularly in nursing home, we could find unmet needs of the patient, have a holistic view of the patient care and care plan, and bring in more communication, intra-team members as well as family and physicians.